Let's begin our discussion by examining the common symptoms associated with cardiovascular disease. Understanding these symptoms is critical for recognizing potential heart issues early on. After this overview, we'll explore the various diagnostic tests that I use in my practice to evaluate the presence and extent of heart-related problems. One of the most typical signs of heart disease or a heart attack is discomfort that may be felt in areas beyond the chest. Many people might experience this discomfort in the jaw or the neck, especially on the left side. Additionally, feelings of unease can also radiate into the left shoulder and arm. This distribution of pain often confuses individuals as they might assume heart-related pain is always located directly in the chest. However, it's crucial to understand that the heart isn't simply positioned in the center of the chest. Moreover, individuals experiencing heart disease or a heart attack may not always present with the classic symptom that many expect, like a heavy sensation, almost like having an elephant sitting on one's chest. Symptoms can vary widely from person to person. Some might feel mild discomfort or a vague sense of pressure, while others may have symptoms that seem completely unrelated to the heart. This variability highlights the importance of being aware of multiple signs beyond the traditionally recognized ones. Recognizing these can lead to timely medical intervention and better outcomes for those affected. Women often do not display the usual signs of heart disease that many people expect, such as pain in the neck, arms, or shoulders. This absence of typical symptoms can sometimes make it difficult to recognize heart-related issues in women. In my observations, many women who suffer from angina, a type of chest pain, don't always report feeling tightness or pressure in their chest like men often do. Instead, they may experience symptoms such as nausea or even vomiting. For some women, nausea can be a significant complaint, overshadowing the more common symptom of chest pain that is frequently associated with heart problems. On the other hand, certain physical sensations can be very telling when it comes to heart health. For instance, if you find that you experience a feeling of heaviness or discomfort during physical activity, like climbing a flight of stairs, it's worth paying attention to. If you feel short of breath or notice tightness in your chest while trying to walk at a regular pace, and these sensations ease once you stop moving but return when you start again, these symptoms may signal an underlying heart issue. Regularly experiencing these feelings during everyday activities can be an important indicator of potential heart problems that should not be ignored. For example, my own father, who was a fairly regular runner in his mid-70s, noticed a peculiar heaviness in his chest around mile 2 while running on the hills in San Diego. Whenever he stopped, the discomfort would fade, but as soon as he resumed running, it would reappear. This was a clear indication to me that something wasn't right. Recently, we had a patient who underwent a cardiac catheterization, a procedure used to examine how well the heart is functioning. During this procedure, it was found that one of his coronary arteries was narrowed. Because of this finding, he received a stent, which is a small device used to keep the artery open. After the procedure, he was able to go back to his normal activities without any issues. What stood out to me, however, was that he didn't experience the typical symptoms like chest pain or shortness of breath that one might expect. Instead, he described a feeling of heaviness. This heaviness is significant because it can indicate that something is not quite right with how the heart is functioning. General fatigue can arise from many different sources, but when the heart struggles to pump blood effectively due to limited blood flow, it can lead to problems. When the heart can't pump as well, there may be reduced blood flow to critical areas like the lungs and muscles, making everyday tasks feel more tiring. This symptom should alert healthcare providers and prompt a closer examination of the situation. Fatigue can stem from various issues, including problems with heart valves, such as leaks or narrowing. Since these are connected to heart health, they require a thorough evaluation. In my practice, over the last 2 decades, I've seen a notable increase in cases of pulmonary hypertension and pulmonary hyperplasia. conditions I view as related to autoimmune diseases. These conditions often present with symptoms like shortness of breath and fatigue, making routine activities feel challenging. Additionally, while sleep apnea itself is not a definitive sign of heart disease, it can contribute to its development over time. On another note, difficulties with achieving or maintaining an erection can also serve as an early warning sign of arterial damage. This is important because blood vessels in the lower body can be affected in similar ways to the coronary arteries that supply the heart. Before I consider prescribing any medications for erectile dysfunction, I require men to undergo a stress test. This test can be conducted either in my office or at another healthcare facility. It's essential to ensure that there are no underlying heart issues before proceeding with any treatment. If you're experiencing erectile dysfunction and find that you need to take vasodilating drugs to obtain an erection, it may signal a serious health issue that requires attention. This condition can indicate the presence of narrowings in blood vessels elsewhere in your body, particularly in the heart, which is a critical concern. It's essential to be cautious and not use these medications without first getting a thorough checkup of your overall health. Peripheral vascular disease, or PVD, is one such condition that affects blood flow. In PVD, the arteries that carry blood to the legs become narrowed or blocked. People with this disease often feel a tightening or cramping sensation in the calves or feet when they walk or engage in physical activities. This discomfort is quite similar to what one might feel during heart issues. Another name for this sensation is leg angina, and it's a clear sign that the blood vessels in the legs may be narrowed. While experiencing leg cramps doesn't specify exactly where these narrowings occur, cramps in the buttocks or thighs usually indicate narrowing in the abdomen or groin area. Conversely, if the problem is located further down, you'd likely feel cramps in those lower areas. If you notice these symptoms, it's crucial to undergo proper diagnostic tests. Several imaging techniques are available, such as ultrasounds, CT angiograms, or MR angiograms, which can help visualize and identify narrowing problems in the blood vessels. Completing these studies is vital for understanding your health better and addressing any potential issues before they worsen. Carotid artery disease symptoms are often overlooked, yet they are crucial. One common symptom I frequently encounter is known as amaurosis fugax. This refers to the sensation of a shade descending over one eye, as if someone were pulling down a blind. It lasts for a few seconds to a minute, after which the shade disappears, prompting people to rub their eyes, thinking something is in them. This experience actually signifies a small blood clot temporarily blocking the retinal artery's blood flow, which then dissolves. The clot is so small that it often goes unnoticed. However, this is a common symptom that many tend to overlook, a sign of small plaques breaking off from the carotid arteries. What other changes can occur? There are 4 major blood vessels that extend from the chest to the brain. 2 are located in the front, known as the carotid arteries, where the pulse can be felt. The other 2 are smaller and situated at the back, called the vertebral arteries. Some individuals experience dizziness when they suddenly change the position of their head or glance quickly to the side. This could indicate a critical narrowing of one of these arteries, particularly in those with vertebral artery disease. Individuals with vertebral artery disease are more likely to report feeling dizzy when they make sudden head movements or look up and down. This is a symptom I frequently come across. Apologies for the pun. If you hear a whooshing sound in one ear, like a stream and not in the other, or if you hear it while lying on one side but not the other, this could often indicate a genuine narrowing in your carotid artery, and no, it's not just your imagination. A carotid artery duplex is a simple, non-invasive procedure that can help detect such issues. These are the symptoms I advise you to watch out for, the ones my patients often report to me and which usually prompt further investigation. So, what should you ask your doctors to check? Most doctors will likely conduct a cholesterol profile test. However, this test may not provide much valuable information. In my practice, I've seen patients with high cholesterol levels who show no signs of coronary artery disease on CT coronary angiograms. This is why I prioritize tests that assess whether cholesterol is oxidized or activated, as these can provide deeper insights. What's more crucial is to look for signs of inflammation. I measure inflammation markers such as heart-specific C-reactive protein, CRP. I also use the LPPLA2 test, which assesses inflammation in blood vessels, and myeloperoxidase, a preferred inflammation marker at the Cleveland Clinic. I do conduct stress tests, and there are various types available. Personally, I prefer using a nuclear scan stress test in my office. However, stress tests are not infallible and can miss true coronary artery disease 15 to 20% of the time. I won't delve into the reasons for this in today's lecture, but it's essential to know that they can miss some cases. In the past, the definitive test for this was a coronary angiogram done in the cath lab. Nowadays, I prefer the CT coronary angiograms, especially the Clearly test. These are becoming more accessible and affordable. The beauty of the Clearly test is that it uses artificial intelligence to look beneath calcified areas in blood vessels and detect what lies beneath those calcifications. A CT coronary angiogram is a minimally invasive test that provides a comprehensive 3D view of the heart's condition. When I encounter these symptoms and complaints, I often opt for a CT coronary angiogram to get a definitive view of the situation. For more fascinating episodes like this one, keep watching. And remember, most commercial mouthwashes can disrupt your oral microbiome and even elevate your blood pressure. If you enjoyed this video, please give it a thumbs up and share it with your loved ones, so they too can learn about the 8 signs of a mini stroke that should not be ignored. Don't forget to subscribe to support our growth, and hit the notification bell so you won't miss out on our next video. Now, we'd love to know, did you already know about these signs of a mini stroke? Share with us in the comments below before you leave. You may also see some other helpful videos popping up on your screen right now. Feel free to click on any of them, or better yet, watch both to continue your knowledge journey with us. Thank you so much for watching, and we'll see you in the next video.